Hi, my name is Ashley Artunian, and this is my health promotion project. So, my patient is AG. She's an 80-year-old Caucasian female. She lives in a two-story home alone in Short Pump, and she is able to independently drive a vehicle. She's retired with a previous career at Reynolds Metals Company, and all of our visits were scheduled in person. During our initial visit, the patient was very engaging and comfortable with being in close proximity to one another. The patient always appeared to be relaxed and very engaging. So, her medical history, she has a history of eczema. She did have a recent fall in December after taking her primidone, which is an anticonvulsant. And she stated that due to her recent fall, she believes it would be beneficial for her to have weekly exercise scheduled to build muscle tone. Improving her health, fitness, and quality of life through regular physical activity is an important topic for any elderly population to support independence and reduce the risk for falls and fractures. So she does wear hearing aids. She wears contacts and glasses. She has allergies to iodine, penicillin, sulfa drugs, and red peppers. She does have a past medical history of AFib and colorectal cancer, and she does not actually have any current medical conditions. So, on her mother's side, she has a family history of ALS and cancer. And on her father's side, she has a family history of Parkinson's disease and tremors. So, upon AG's physical assessment, her height is 5'3". She is 112 pounds. She has a BMI of 18. Her blood pressure is 105/65. Her skin color was appropriate for race. She does have a steady gait, no incontinence issues, no assistive devices needed, and she did pass her get up and go test. So here I have a picture of the fall risk model that I did for her. As you can see, even though she did have a fall back in December, she is a relatively low risk for falls. What puts her at the greatest risk is that she does take two anticonvulsants, which we will discuss on the next slide. So her medications that she takes are primidone, which is one of the anticonvulsants. She takes 50 milligrams of that. She also takes Eliquis, 5 milligrams, which is the other anticonvulsant. And then she takes a vitamin D3, which is 125 micrograms. So, AG's nursing diagnosis is that I wanted the patient to have a program of regular physical activity related to the awareness of health benefits from physical activity as evidenced by expression of eagerness to begin an exercise program. As we age, our bones tend to become more brittle and break more easily. The joints also break down and can lead to stiffness, inflammation, and pain. Exercise improves strength and flexibility, which can also help to improve balance and coordination and reduce the risk of falls. Seniors take much longer to recover from falls, so anything that helps avoid them in the first place is very critical. Studies have shown that maintaining regular physical activity can help prevent many common diseases such as heart disease and diabetes. Exercise improves overall immune function, which is important for seniors as their immune system often becomes compromised. Even light exercise, such as walking, can be a powerful tool for preventable disease management. Exercise also provides a way to relieve stress and improve your mental health. It has also been linked to improving circadian rhythms. My short term goal for the patient was that by September 16th, the patient will be able to verbalize accurate information about the benefits of increasing physical activity and strategies to develop a personal program of increased lifestyle activity. A method for evaluating this outcome would be to ask the patient to name 5 benefits of increasing physical activity. The long-term outcome for this patient was that by October 1st, the patient will perform physical activity such as walks around the neighborhood for 30 minutes at least 2 days per week. A way to evaluate the outcomes would be to complete a physical assessment every couple of months to observe for changes in muscle tone and strength and perform a lipid panel to measure her LDLs, her triglycerides, and her total cholesterol levels. So, this topic relates to Healthy People 2030, as one of their major focuses is on how to improve the health and well being for people of all ages by promoting aerobic and muscle strengthening exercise. The goal is to create more accessible and safer exercise plans for adults by catering to home workouts and creating more access to community programs. Older adults are at a higher risk for chronic health problems like diabetes, osteoporosis, and Alzheimer's disease. In addition, 1 in 3 adults fall each year, and falls are the leading cause of injury for this age group. Physical activity can help older adults prevent both chronic and fall related injuries. So, AG was very motivated to create a plan that she knew she would remain accountable for. We agreed upon a goal of easing into this physical activity by beginning regular walks around the neighborhood for 30 minutes, 2 days per week. I introduced the concept of brisk walking, which is a less intense way to partake in aerobic exercise. Brisk walking is extremely beneficial because it accelerates your heart rate and it works the muscles and causes less strain on the joints. Education provided for brisk walking included me demonstrating how to appropriately improve stride and by swiftly switching the legs back and forth and swinging the hips slightly with each step. Maintaining an upright posture with shoulders back also creates a maximum benefit with this exercise. After the demonstration, I asked AG to attempt the brisk walking technique. Because AG is a kinesthetic learner, having her repeat the demonstration catered to her learning needs by carrying out physical activity. To maintain this goal, AG decided to partner with her neighbor and complete the walks together each week. This allowed AG to stay accountable in order to achieve her goal. So, according to Nottenhoff and Cartensen, walking helps to maintain physical and cognitive independence by decreasing the risk of falls, cardiovascular disease, colon cancer, and frailty. The CDC recommends that an older adult complete 150 minutes of moderate intensity physical activity each week. Once AG became comfortable with her weekly walking routine, we discussed incorporating 1 day of stretching and chair yoga for 30 minutes at home to improve her flexibility and balance. Because AG has hearing aids, I provided her with written instructions on scheduling exercise, as well as photos on the different stretches and exercises so that she would be able to reference all of these teachings at any point. So here is one example of one of the printed out references that I gave to AG for her chair yoga and exercise. You can see on the page there are different positions and exercises with instructions on how to do these exercises appropriately. So then her evaluation on September 16th, AG and I met again to review her progress. She was able to state accurate information regarding the benefits of physical activity. I also assisted her with downloading a yoga app to use for her stretching because she loved it so much. The plan was that we wanted to help AG achieve her long term goals, so we purchased her a calendar and marked the 2 days a week that she would be participating in the brisk walking, and then the 1 day a week that she would be doing her stretching and her chair yoga. So she decided that the 2 days that she wanted to do her exercises with brisk walking would be on Tuesday and Thursday. Monday became her designated day to do her chair yoga and her stretching. To help with maintaining accountability, AG's neighbor would call her every morning of their scheduled walk to remind her and motivate her. I followed up with AG once a week to see how she was progressing and ask if there is anything I can assist her with regarding long term goals and her health plan. AG's exercise plan is considered to be primary prevention as it aids in strengthening her joints, her bones, and her all over physical and psychosocial well being. It also had tertiary prevention as she does have AFib, so that reduces the risk of the chronic heart conditions and preventing debilitating issues related to the heart disease. The teaching was very effective. By catering to AG's learning style, she felt more equipped to begin her exercise program. Having a mutual agreement with her neighbor allowed AG to maintain accountability with sticking to her new routine. AG is still maintaining compliance with her activity program currently and has begun to enjoy her time exercising. The teaching was affected as evidenced by compliance with the plan and eagerness to incorporate various exercise with walking. AG does not quite feel ready to integrate in strength training into her routine just yet. The aspect of exercise feels overwhelming to her. It's important to recognize the patient's limitations and go slow with building on her program. I wanted AG to remain compliant with her program, so we're maintaining that slow and steady approach to her plan. Ways that my teaching strategy could have been revised would be to incorporate some light weights into AG's brisk walking. Building muscle is an important way to preserving functional activity in the elderly. I would also like to incorporate a few more days of balancing exercise because of AG's fall back in December. An important note is that AG's doctor did recently share with her um, that although she is a good weight, she has no muscle tone and is at risk for atrophy. By having AG partake in more balance and core strengthening exercises, she will build muscle strength and decrease her risk for atrophy. So these are my references, and thank you very much.